my skin, and while they seem kind of normal, they are actually
Joseph
symptoms of
Wang is a normal
neurofibromatosis.
10th grade student at Corona Del Mar High School. He enjoys playing rock band, doing homework, and reading. However, there is more to Joseph than meets the eye. While he may look like a normal teenager enjoying his life, Joseph actually is afflicted with a common genetic disorder called neurofibromatosis.
So what is neurofibromatosis?
It's a disorder that affects a lot of the skin. A lot of times there's like tumors growing on your skin, stuff like that.
Neurofibromatosis actually is a disorder that affects the nerve cells of the body, causing tumors on the skin. A dramatic representation of the disease is showcased in the 1980 film Elephant Man.
So, then, gentlemen, owing to this series of conditions, the congenital exostosis of the skull, extensive papillomatous growth, large pendulous masses in connection with the skin, the great enlargement of the right upper limb involving all the bones, the massive distortion of the head, and the extensive area covered by papillomatous growth, the patient has been called the Elephant Man. Thank you.
At the time of the film's release, John Merrick, the Elephant Man in the film, was thought to have a form of neurofibromatosis, the same form that Joseph has, neurofibromatosis type 1 or NF1. This is in contrast to other forms of the disorder, neurofibromatosis type 2 or NF2, and schwannomatosis. All three forms of the disorder are similar in how they are inherited. Neurofibromatosis is characterized by being autosomal dominant, meaning that a parent showing signs of the disorder has a 50% chance of passing the mutant gene onto their child.
In NF1, the mutant gene affects a protein on the 17th chromosome called neurofibromin. This protein suppresses tumors, and when there are two mutant copies of the gene, this protein is missing, thus causing the rapid growth of tumors since there is nothing to suppress them. The same process occurs in NF2 and schwannomatosis, though with different genes on different chromosomes. NF2 on the 22nd chromosome affecting the protein myelin, and schwannomatosis being such a new form that scientists do not know much about it. Though the inheritance of the different forms is quite similar, the symptoms of NF1, NF2, and schwannomatosis are quite different.
NF1 is most common of all the forms of neurofibromatosis, with about 1 in every 4,000 born individuals affected by it. In order for a patient to be diagnosed with NF1, two of these symptoms must be exhibited in the physical characteristics. These symptoms can appear as early as right after birth and can increase in severity as the child gets older.
The most common of these symptoms are called cafe au lait spots, which is what Joseph has. These light brown spots range in size with numerous bigger spots, often leading to the diagnosis of NF1. Neurofibroma are tumors that arise from the nerves in the skin. These are not necessarily large tumors, but instead can be small pea-sized bumps. 2 or more neurofibroma are necessary for diagnosis. Optic gliomas are tumors along the optic nerve or optic chiasm behind the eye. These are fairly common, as 85% of patients diagnosed with NF1 under the age of 15 showed signs of optic gliomas. Lish nodules are small tumors located on the iris that don't affect vision. Like optic gliomas, they are very common, as 94% of patients above the age of 6 had 2 or more Lish nodules. Skeletal abnormalities such as scoliosis or thinning or overgrowth of bones in the arms or legs can also be determining factors in the diagnosis of NF1. Presence of the disorder in family history can also signify the appearance of NF1 in an individual. However, the disorder can also be contracted through spontaneous genetic mutation at conception. In fact, nearly 50% of all reported cases of NF occurred in patients that had no family history of having it. We know that Joseph Wang has neurofibromatosis type 1, but how was he diagnosed with the disorder?
Do you have any tumors on your skin?
I don't have any actual tumors, but I have this spot on my cheek and several all over my body called cafe au lait spots. They're kind of darker than my skin, and while they seem kind of normal, they are actually symptoms of neurofibromatosis.
What are other symptoms of neurofibromatosis?
In addition to the cafe au lait spots and the tumors, there are things called optic gliomas, which are tumors in, I believe, the optic nerve in the eye. I actually have those too, which is why I would need glasses. I can't see very well.
Has anyone in your family had neurofibromatosis in the past?
My grandfather had neurofibromatosis. A little more extreme in this case, but yes, he did.
Joseph has 3 symptoms of neurofibromatosis type 1: cafe au lait spots on his cheek and all over his body, an optic glioma, and a family history of NF. Since only 2 of the symptoms listed need to be present in order for a diagnosis, it is clear that Joseph has NF1. By observing any changes of the body and using MRIs and X-rays, doctors are able to check for different symptoms of NF and make a diagnosis, just like they did with Joseph.
NF2 is quite distinct from NF1 due to the differences in symptoms. NF2 affects the auditory nerve, the nerve that carries sensory information from the ear to the brain. Tumors grow along this nerve, the spinal cord, and within the brain. Unlike NF1, NF2 affects these areas instead of the whole body. NF2 is also less common than NF1, with about 1 in every 45,000 births.
Symptoms of NF2 include vestibular schwannomas, seizures, tinnitus, cataracts, and hearing loss, deafness, or balance problems. Vestibular schwannomas are the tumors that grow along the auditory nerve. As they grow, they cause other symptoms such as tinnitus, which is a constant ringing in the ears, and in severe cases, deafness. Symptoms of NF2 do not usually appear until the late teens to early 20s. This is because schwannomas are slow growing, so while an individual may be affected at an early age, symptoms are delayed until the tumors have developed. Typically, individuals experience hearing loss or tinnitus first, which is a sign that they may have the disorder. The third type of NF, schwannomatosis, is often misdiagnosed as NF2 because they both have similar symptoms. It is mostly characterized by the intense pain felt by a patient due to the schwannomas on sheaths, or coverings of nerves. Because it is such a newly established strain of neurofibromatosis, experts are in the process of learning more about it. Even though neurofibromatosis is not a new disease, research is still being done to find new information on it. Although surgery can remove some of the tumors, scientists are trying to find other solutions to the disorder. With many foundations focused on bringing awareness to neurofibromatosis, as well as the work being done to better understand the disorder and its different types, the future is full of potential for scientists and people like Joseph who would like to live a normal, healthy life.